Good afternoon, and thank you for joining me. I'm pleased to announce an important piece of legislation that's part of our ongoing response to the COVID-19 pandemic. Now, Bill 24, the COVID-19 Pandemic Response Statutes Amendment Act 2020, introduces amendments to 15 acts across 7 ministries. These amendments will protect public health, support Alberta's reopening, and make life easier for Albertans. The state of public health emergency ended on June 15th. It gave government 2 kinds of increased powers. The first was it enabled ministers to temporarily amend, suspend, or modify legislation. And second, it gave government and AHS certain powers such as the conscription powers, expiration powers, and directing or requiring activities which were required to respond to the pandemic. The state of emergency was the right thing to do. And it was required to prepare us for the risk of COVID-19 based on the risk as we understood it at the time, because that risk was hard for us to scope initially. And in the worst case, the potential impact was very severe. But the risk, as we know today, based on our actual experience, is very different. Emergency powers should last only as long as they're absolutely needed, and the state of emergency is no longer required. So, those very broad and general emergency powers have ended. But we carefully reviewed our existing amendments to legislation and orders, and we're extending a few of them because we may still need them in the future. Now, it's important to note that compared to many other jurisdictions, Alberta has had some of the lightest restrictions related to COVID-19, and yet also had some of the best results in terms of cases, deaths, and the burden on the health system. We're also introducing some specific measures to support the safe reopening of our economy. So first, in terms of protecting public health, Bill 24 will ensure the intent of the ministerial orders put in place to respond to COVID-19 remain for as long as they're needed. The bill also proposes creating a new regulation-making authority to support and empower orders of the Chief Medical Officer of Health as required. This would give her the authority to act if and as required without an official state of public health emergency being declared. We're also proposing to extend arrangements which allow a healthcare facility to limit employees to working at one site only. This would ensure that staff continue to be limited to working within a single continuing care facility to help prevent the spread of infection between facilities. The bill would extend other existing measures to give Albertans the services and supports that they need as we, as a province, continue to reopen. For example, one amendment ensures that childcare providers will have access to the most up-to-date guidance to operate safely. This includes changing the maximum number and age of children permitted as required to address future risks of COVID-19 transmission. This will help reassure parents returning to work that safe childcare is available to their children. We're also proposing to extend unpaid job protection leave related to COVID-19 until August of 2021. This will allow Albertans to take unpaid leave if they have to leave work to care for a child due to school closure or care for a sick or self-isolating family member. The bill also proposes to extend the maximum time for temporary layoffs related to COVID-19 from 120 days to 180 days. This will ensure an employee stays connected to a job even if operations are temporarily suspended or if the employer cannot recall an employee due to physical distancing requirements. Now, as well, we're proposing to continue measures that will help reduce red tape and improve access to services for Albertans. For example, the bill proposes continuing to allow for remote signing and witnessing of some legal documents through two-way video conferencing. And this would make it easier for Albertans to have legal documents signed without having to visit a lawyer's office. There are also new measures, including ensuring Albertans retain their rights to appeal compliance actions brought against private career colleges, or for the government to make claims related to student finance assistance. And we're also recommending a new measure which would extend the grace period of expired board member appointments for the Apprenticeship and Industry Training Board. The term would change from 3 months to 5, which will also allow experienced members to continue on the board while recruitment is carried out. As well, the bill introduces a new measure to give municipalities more flexibility to respond to COVID-19 and future provincial emergencies. For example, it will continue to allow for the suspension or modification of permit requirements for temporary facilities such as drive-through COVID testing sites. Now, you might ask why we're bringing this legislation instead of just extending the state of public health emergency. And the answer is the state of emergency is a temporary tool and it's no longer required. Alberta's COVID-19 case numbers remain stable, and our healthcare system is able to manage the demands for services. For the COVID-19 virus will be with us for a while, so it doesn't make sense to keep the state of public health emergency in place indefinitely. Going forward, the proposed amendments will ensure that we have the tools that we need for the next phases of relaunch. We also want to ensure we're transparent with Albertans about when and how we as a government use emergency powers. Now, before I close, I'd like to note another initiative that's separate but related. The legislature on Monday approved the appointment of a Select Special Public Health Act Review Committee. This committee includes 12 government and opposition MLAs. It will review the act and submit a report to the legislature within 4 months. The appointment of the committee recognizes that the pandemic and public health in general is not a partisan issue, and I look forward to the report. So in closing, Albertans should be very proud of this province's response to the pandemic so far. We've used a lighter regulatory touch than most other places, and yet also had better results here in Alberta. And that's for 2 simple reasons. Because we've all done the right thing to slow the spread of the virus throughout our province, and second, because our health system has been a national and international leader. Let's review again where we've been as leaders throughout this response to the pandemic. The first is with testing and our ability to expand our capacity and be able to have testing at a higher rate per capita than most other jurisdictions. Contact tracing, online self-assessment, real-time case data, our ability to procure on massive quantities of PPE throughout the province to be able to respond to the pandemic. Clinical infection control, partnerships throughout the pandemic, like the Sprung facility in Calgary, the e-ventilator, the distribution of masks for the public by drive-through restaurants. The pandemic has been a test for all of us and for the health system. And we've not only passed it, we've been a success story that many other places can learn from. And thank you very much, and I'm happy to take any questions.
Yeah, thanks. I think we have reporters waiting in the queue, so can we have the first question, please?
Yes, thank you. The first question is from Janet French of CBC. Janet, your line is open. Please go ahead.
Hello. Thanks for taking my question. Sorry, I just need to flip to a different page.
That's right.
My question is about the one-site rule, the wage top-ups. So how long is the healthcare aid wage top-ups going to last for, the $2 an hour ones? And why are we still waiting to hear about the federal provincial wage top-up program that was announced and which workers that would apply to?
Sure. Well, the wage top-up for our healthcare aides, as we said when we announced it, is going to last during the pandemic. So really, until we have a vaccine in this province, we're going to continue with that program. We announced that specifically to address with our concerns with retention and recruitment. At a point in April, I think we saw, especially because of the one-site, one-worker rule that was implemented, we saw an absenteeism rate of about 20% for healthcare aides at that time. So we implemented that program to be able to address that as absenteeism for that one profession, that one occupation in particular. And we've seen positive results for it. We're going to continue with that top-up for that occupation during the pandemic, and especially while we still are requiring the one worker, one site rule throughout the response to the pandemic. Regarding your question about the federal program, I know that the Minister Copping has continued to work with his counterparts in the federal government to be able to work with them on how that program can apply to workers in Alberta. And I look forward to him being able to let us know and announce something about how that program is going to apply to Albertans.
Thanks, Janet. We'll try to stick to one question and follow-up. Did you have a follow-up? Okay. So next question, please. Sorry, go ahead, Janet.
So my question is, the unions for a long time have been calling for a more consistent way of paying these workers. And if the one site, one rule scenario is going to continue for months or maybe a year, what would you consider something that's more top-down as far as standardizing wages, standardizing working conditions, standardizing hours, regardless whether or not a site is public, private, nonprofit for long-term care?
Well, first of all, let's just review what this program applied to. So we have 400 sites in continuing care in the province and 100 of them are AHS and Covenant. So this was addressing with our contract providers. And about half of them are nonprofits, half of them are private providers as well. But that's the rest of the system, these 300 sites. Most of them, I think 206 of them, that top-up is being implemented right now for those workers. It was retroactive as well. I can't remember the date off the top of my head, but it was retroactive. It's been provided to those workers. There are 94 sites where the union, the AUP, has filed a grievance. And so because of that grievance that was filed by the union, that's held up the amounts being able to be paid by our independent providers, both nonprofits and private, to be able for them to be able to pay the top up to those workers. I look forward to the AUP and the employers sitting down and being able to resolve this issue. So, because look, these workers deserve that money. This needs to be dealt with quickly by these folks. I expect the AUP to want to work with the employers to resolve this issue and allow these workers to get what's owed to them.
Okay, thanks, Janet. We'll take the next question.
Thank you. Michelle Bellefontaine, CBC.
Oh, hi, Minister. Thanks for taking my question. I wanted to ask you about the extension of unpaid job-protected leave until August 2021. So I just wanted to just be clear. So that includes the 14 days of unpaid leave and that people won't need a doctor's note, and also that they can take leave sessions more than once consecutively.
Just because it was muffled, I couldn't catch a couple words at the beginning of Michelle's question. So,
yeah.
Okay.
Michelle, do you mind repeating it?
Let me try that again. Sorry.
Sure.
Is this better?
Well, maybe. I did catch most of it. There were just a few words. If you just don't mind repeating it, hopefully the words I missed at the very beginning.
Yeah, for sure. Yeah. Okay. So the unpaid job protected leave, the extension to August 2021. So I was just looking on the website about the conditions of the present unprotected leave, unpaid job protected leave. Sorry about this. So that still includes 14 days of unpaid leave, and a worker can take it more than once consecutively, and they don't need a doctor's note if it's COVID related. Is that correct? Is that still going to be the same?
So maybe, do you mind, Graham, so we do have other officials, if we can, Humyra, if you don't mind coming up, and sorry, I don't have the list of everybody's name.
That's okay, Minister. We'll ask
but
if
you
when we call them.
yourself, Humyra, and your title with Labour and Immigration.
Sure. Hi, I'm Humyra Sabir, Executive Director of Policy with Labour and Immigration. And so in response to that question, there are two different types of job-protected leave specific to COVID. So there is a 14-day self-isolation leave. That leave does not have an expiry attached to it. The job-protected leave that the Minister has referenced is a leave that does not have a prescribed period of time. It had been introduced for circumstances where an individual needs to take time off work to care for a child because of a school or daycare closure, or in relation to caring for someone who is ill with COVID or required to self-isolate. So that particular leave would have expired on August the 14th, and that is the one that is being proposed for an extension.
Okay. So just to be clear, so say if I'm a parent and I'm having a very hard time finding daycare for my child, and it looks like, I may have to be off a month while I deal with this. I could qualify for why do I keep screwing this up? Unpaid protected leave. Like, I wouldn't lose my job because of this. Is that correct?
So it does offer job protection. So there may be circumstances in which an employer may request some type of documentation to substantiate the need for the leave, but it does offer job protection to an employee while they are on it.
Okay. Sorry, to the minister, sorry about this. I know I'm taking up another question, but has there been any consideration about offering people paid leave to deal with circumstances related to COVID? Not so much what we just talked about with, the daycare situation, but someone who is sick and can't work has to stay home for 14 days.
For us to legislate that employers should be providing that to their employees, that's your question?
Yeah.
Well, I suppose I'd have to kick that to Minister Copping, and if you don't mind us connecting you with him, with Minister Copping, I think that's really a question for Minister Copping as the Minister for Labour and Immigration, for him to be able to answer for you, if you don't mind.
Yeah, thanks, Michelle. We'll go to the next question.
Thank you. The next question is from Dean Bennett, Canadian Press. Please go ahead.
Thanks. Thanks for taking my question. Minister, I wonder if you can, I'm looking for a broader analysis from you. The theme that runs through this bill is that obviously COVID's not going anywhere anytime soon, and we expect to be dealing with this for at least another 14 months, given the August 2021. So my question, I guess, is can you update us where we're at for the long term in your discussions with Dr. Hinshaw? So, for example, based on this, can we expect large gatherings to even be a remote opportunity until maybe the new year? Phase 3, are you looking at perhaps some stricter rules around wearing masks? What can Albertans expect? It's a broad question, but I'm kind of just looking for an update, I guess.
Sure. I guess I would say, just as medical professionals and medical officers of health, or the equivalents in other jurisdictions, have grappled with the same question. I think the answer is this is new, and we're still trying to figure out to the extent that COVID-19 is similar to influenza pandemics, and the ways that it's different. Because this is new, we're seeing new research that's being published every day, let alone every week. I think as we continue to see that information being published, and for our medical professionals, including Dr. Hinshaw, to be able to take that new information as it gets published, and as we learn more about the virus and how it's spread, then they can give us the medical advice on how restrictions could be eased. For adding restrictions, just to note again that what we're doing now is monitoring on a active case per 10,000 population basis. We're looking at every municipality, and as we see the active cases go above 50 per 10,000, we'll be looking at those municipalities on a local scale, working and trying to figure out where do the active cases come from, how is the spread happening in that community, and then working with the local communities on whether added restrictions will be needed. But as it comes to lifting any restrictions, it's going to really depend on the new research that it continues to be developed over the months, let alone a year, that continues. For example, if we start to see evidence that outdoor transmission is not happening as much, we've also looked at the restrictions that we have on capacity are 4 different categories, whether it's indoor, outdoor, whether it's seated or not seated. We're going to continue to review those capacity limits on a weekly or biweekly basis, and whether there has to be recommendations to Cabinet on easing in those restrictions based on the advice of Dr. Hinshaw in her office. So that's really how it's going to go over the next however long COVID is with us in the province, unfortunately.
Thanks, Dean. Follow-up?
Just one. The mask issue that seems to be coming up more and more. People are looking maybe for having a mandatory on the LRT or something like that. Is that Dean Hinshaw's call? Is that your call? Is that both? And is that something you're looking at?
Well, look, all of our decisions are based, through consultations, based on her advice, and all the decisions we made when we had emergency management cabinet committee, or even as we continue to make decisions as cabinet, we're making them based on the best available evidence. I think we've made it clear that we as a government have no interest in mandatory masking. I think that I think part of the reason that we've had such a good response to COVID-19 is because Albertans want to comply with our public health measures, and there has to be a buy-in by Albertans. So making something like that mandatory, I think especially when there doesn't seem to be any evidence on a need to make it mandatory, but we want the idea of masking when physical distancing isn't possible to be socialized. Big reason why we're the only jurisdiction to have the distribution of 40 million masks among Albertans, so that they can have at least some interim supply and start using them when physical distancing isn't able isn't possible, I should say.
Thanks, Dean. Next.
Thanks. Ashley Joanno, Post Media.
Hi, good afternoon. You made some general comments early on. These orders would be sort of temporary and only in place for as long as necessary. I'm hoping, I guess, to get some more specifics. Specifically with the health orders, what are the sunset clauses that are going to be in place for these orders?
Sure. So there's two sunset clauses that are going to be included in the bill, and one is to a set date to the extent to which the orders of the chief medical officer in health are in place, or whichever is earlier. So I would also point out, though, that as I mentioned, the Select Special Committee of the legislature is going to be reviewing the Public Health Act in its entirety, and they will have to provide a report to us within the next 4 months. This is going to be included in what they're going to be looking at. We're going to be asking them to also consider, to the extent to which sunset clauses are required for these amendments, or any other emergency powers that might be given to a government in the future. So that's going to be a big part of what that Select Special Committee is going to have to review for us.
So what is that specific date, though?
Well, I think we're going to have to wait for the bill to be tabled, but there is a specific date at the time. Or are we allowed to mention the specific date? I just don't want to incur a point of privilege from my colleagues in the legislature. So, but there is a specific date, as well as the extent to which the chief medical officer of health's orders remain in place.
Thanks. Next question.
Thank you. Tim Brock, CTV News.
Hey, thanks for taking my question. The first one for Minister Shandro. You touched on it briefly, but can I just get some more clarification on why the state of public emergency was lifted? You said that it's no longer needed moving forward, but a lot of the things proposed in this bill seem like it is still needed. So can you just clarify a little bit?
Sure. And I know that it probably is strange that you have before you a minister who's asking for less power. But look, the point of a public health emergency is to do a few things. And one of the most significant that we were considering when we made the declaration on March 17th was the conscription powers. If we ever needed to conscript any workers to work at a certain site, or the expropriation powers. At this point, we don't need any new additional powers to be able to respond to the pandemic. We also want to be transparent with Albertans, as I made it clear in my opening comments. We want to be open with Albertans. We have I think the powers that already in place right now for us to be able to continue in responding to the pandemic until we get to a vaccine. And so at this point, there isn't a need for the public health emergency to be in place.
All right. And then my follow-up, this one's for a colleague, so you'll have to excuse, it's kind of a two-pronged question. We just want a little bit of clarification on health measures for restaurants and retailers. Firstly, are staff at restaurants and retailers legally required to wear masks? And how exactly would a private business be held liable if they aren't following those legal requirements?
So I have with me Assistant Deputy Minister Graham Statt, who's the incident commander for our response to the pandemic right now. And maybe, Graham, if you want to be able to answer the specific question about the restaurants.
Sure. Thank you for your question. What we've produced is guidelines for these businesses and organizations which are posted on BizConnect, but they are indeed guidelines, and we strongly recommend the use of a mask when that gap of 2 meters needs to be closed, including in places like restaurants by those serving staff.
Okay, but as far as it's legally required, it's just a strong recommendation right now. For staff, it's not legally required. Is that correct?
So these are guidelines. It's a strong recommendation. And what we're saying is that businesses should comply to the extent possible with these guidelines. If something particularly egregious is going on and in complete disregard to the guidelines in their entirety, then further action would need to be taken by our public health staff in that case.
Thanks. So
maybe before we take the next question, I'll just supplement that. I think this has been one of the difficult parts for us as a government, is trying to communicate to Albertans the difference between guidance and an order. And so there's been both. There are orders and there are requirements that are mandatory, that are in an order of the chief MOH of the province. But we also have guidance, and that doesn't mean that we conflate the two, and it doesn't mean that all of the guidance we're providing to businesses so that they can protect their employees and their patrons, that there is a difference. Unfortunately, it's a little bit difficult for Albertans to always know the difference between our guidance and our orders. But just to remind folks that there are things that aren't mandatory, but just guidance we're providing to businesses.
thanks. So I think we have time for two more questions.
Thank you. Sir Walter Saskew, City News.
Hi. Yeah, this question is for Minister Shandro. Why, with regards to extending the temporary layoffs from 120 to 180 days, why is that important? And does that mean that the 180 days businesses have to rehire staff? I'm just curious about that one.
Sure. Well, I mean, the idea of a temporary layoff is that an employee can stay attached to a job. And there could be a number of situations, and that's why the legislation contemplates allowing an employer sometimes, for whatever reason, it might be economic, it might be some other circumstance. In this situation, it's a pandemic, that whether it's physical distancing or because there might have been a business that ended up being closed in the pandemic, we wanted employers and employees to have that flexibility. So an employee could stay attached to that job without being fired. What we're doing by extending the deadline is that employee can stay attached to the job without an employer being forced to make a more difficult decision.
And my other question is with regards to, why was it important to protect parents and provide them with this unpaid job protection leave when their kids are sick? Was there an issue where parents couldn't do this before? Was there something that was, you guys were hearing about from parents contacting the province, or is this just a decision you made?
This is when we originally announced it at the beginning of the pandemic? Is that what you're asking about? I think we just were aware of the difficult. I mean, look, many of us in cabinet are parents ourselves. So I think we knew the difficulties that parents, the province, were going to have to be able to comply with the physical distancing that we as Albertans were going to have to implement in our daily lives to be able to slow the spread of the virus. So I think that's why we made that decision very, very quickly, because I think we just knew, because many of us in cabinet ourselves are parents.
And I think we could get a quick supplementary comment from Labour.
Oh, sure. Humyra?
Beg your pardon, you probably have a name like a person, but in this room you're just Labour.
Hi, thank you. So in relation to the job protected leave, one of the reasons a new leave was introduced was the existing leaves under the legislation require an employee to have been employed for 90 days in order to be eligible, and to support the public health intent of making sure that people who had ill family members did not need to go to work. This leave does not have that requirement.
Good. Yep, thanks
Time
for that.
for one more?
Yeah, we'll take one more question.
Thank you. The final question is a follow-up from Michelle Bellefontaine, CBC. Please go ahead.
Hi, Michelle.
Hi. So just to follow up on some earlier questions about the sunset clause on this bill, and I know you were talking about concerns over a point of privilege about telling us that. We ran into this a couple of days ago with another technical briefing, and we clarified to the Premier's office that you are allowed to talk about the bill. You just can't read from the bill, and you also can't just give us a copy of the bill. So if you could please tell us what those dates are, that would be very helpful.
Okay, yeah, no, thanks, Michelle, for clearing that up for me. So Graham.
Yeah, no worries.
Yeah, if you want to speak to the sunset clause, then, Graham.
Yeah, I can certainly do so. Thank you, Minister. So there's a sort of a double sunset involved here. First of all, these amendments are being put in place to continue to empower the orders of the Chief Medical Officer of Health. And as time goes on, those powers, if they're no longer needed because the order comes to an end, it'll automatically be sunsetted. So all these amendments are inherently temporary in that regard. But also what the bill contemplates is, in any event and in any case, by December 31st, 2021, all of these elements will come to an end. And I think, as the Minister has already indicated very clearly, part of what the intent of the government is doing here is to get that advice from the all-party committee in terms of what elements of the bill should continue on and what elements of the bill should be revisited into the future, and in terms of the review of the legislation itself.
Okay. Thanks, Graham. We're right at 1:45, so with that, I'll wrap up. Thanks all. If you have follow-up questions, please contact me or the appropriate department, and thanks again.